Good morning. It's a pleasant surprise to see so many people up this early in the morning for this dementia policy briefing, a growing public health concern. So welcome to all of you, and thank you. First, let me thank the organizers of this event, WISH, for arranging for all of us to be here to discuss this important issue of dementia. Now, all of us are living in a time where transitions are happening. Transition in terms of financial and social transitions, which are particularly evident in this part of the world, and consequently, we are seeing a lot of emergencies and problems happening in this part of the world. And at the same time, there is an epidemiological transition happening. Populations are aging, and the profile of diseases is also changing from communicable to more non-communicable diseases and their associated risk factors. And dementia shares that particular space, that it has all the shared risk factors with the main NCDs. And that's why, if we look at the numbers, they are horrific. And the response which has been generated over the last few years has been gathering pace, starting from 2011 UN Political Declaration on NCDs, which mentioned specifically dementia. And then we had the subsequent developments which have taken place over the last 4 to 5 years. And we have Dr. Saxena, Director of Mental Health and Substance Use with WHO, who will take us through all those developments today. And if you remember that in 2013, there was this G8 summit on dementia, and subsequent to that was the development of World Dementia Council, and we have here the newly minted president, Dr. Mike Hobday of the World Dementia Council, and at the same time, there was this alliance on Alzheimer's and Dementia Action Alliance, which was also formulated around the same time. And we have Dr. Mark Wortman here from Alzheimer's Disease International representing in the panel with me. And last but not the least, we have the hosts, Dr. Hanadi Al-Hamad, who is working in Qatar and is specifically interested in the issue of dementia. So this is the panel we have today with us. And without further ado, I'll hand over to Dr. Saxena to take us through the objectives of this particular briefing, and at the same time, introduce why we are considering dementia as a public health concern and the developments which have taken place and the plans we have going forward. So Dr. Saxena, over to you.
Thank you very much, Dr. Khalid, and a very good morning from me to all of you. Dementia is a silent epidemic. We are living in a society where there is more of dementia every day, every month, every year that we are seeing. And unfortunately, we are still not paying as much attention to this topic as we should be. Let me take you through some of the facts and figures, and also then on some of the responses that have been there for dementia. The population is aging. The world, as you see on this slide, is becoming darker. In all parts of the world, the population is aging, we are living longer, and that is one of the main driving force towards a higher incidence and also higher prevalence of dementia. If you see the numbers by the regions in the world, this is what the numbers are for 2015. As you can see, in many regions of the world, the numbers, in this case in millions, is quite high. But as you see, as the time passes, the numbers keep increasing, and eventually you will see the numbers as doubling and tripling over this period of time. And this is taking place in all regions of the world, and not only in the so-called developed regions of the world. The prevalence of dementia in the particular region that we are in, the Eastern Mediterranean region, is not low at all. There is the crude estimated prevalence that you see here for the particular regions, and also the numbers of people with dementia in millions that is increasing. The graph is really, really steep. The numbers are going to become very high in the next coming decades. The global incidence and prevalence, the figures are very clear now. We have enough epidemiological data. Nobody can say, you did not tell us. The numbers are there for everybody to see. One dementia case every 3 seconds. The numbers keep increasing over a period of time, doubling and then tripling over the decades that many of us, not me, but many of you, hope to live for. The meta-analysis estimates over 9.9 million new cases of dementia every year worldwide, and the overall incidence of dementia in low and middle income countries is only 10% lower, and in fact the numbers are much higher because of the population. Let's see how the cognition behaves over a period of time. This chart shows you how the cognitive health behaves from midlife to later life. The normal cognition does go down, but let's remember that dementia is not a normal decline in cognition. Dementia is a disease. And when the decline happens much faster and much more, it becomes first the MCI and then dementia as a disease. There are many factors which give rise to it. Factors in early life experience, lifestyle factors, environmental, medical risk factors, but also protective behaviors, which either make us more prone or make us less prone to undergo this cognitive decline and eventually the onset of dementia. How the world is responding to this, we don't even have, for many countries, any strategies or any dementia plans. For some of the regions like Euro, the numbers are higher, but even then, it's just a little more than 50% that have the plans. But in this region, and also in African region, the numbers are very low. The countries are still not waking up to the threat that is coming their way. In WHO, we are establishing a global dementia observatory just to make sure that people know what they are getting into. This is to help countries to support individuals with dementia and to reduce the disease burden and cost, to better understand countries' needs for evidence-based service planning and policies, and to strengthen their capacity, to monitor progress within countries and globally, and to share best practices, which is a very important part, because many countries have good practices and best practices, and we need to share that to create a knowledge exchange platform. WHO has many observatories. We know a lot about malaria, tuberculosis, HIV, and we track that over a period of time. But so far, there is nothing on dementia. That's what we are establishing now, so that we can provide the kind of information and knowledge which the countries need. There is an elaborate framework for the Global Dementia Observatory. We have areas like policy, resources, burden, and also the response that countries are having at individual level, at population level, and also at governance level. So we'll collect these information and make them available to every country. We have done a pilot based on the readiness to take part in this, and also consisting of high but also low and middle income countries, and some countries, including this region, have taken part in the pilot, and these countries are already one step ahead, but all the countries will be covered in all the regions of WHO. WHO has already a number of strategies and plans. Dr. Khalid Saeed referred to some of them. For example, the political declaration on NCDs, which did mention dementia, although did not cover it extensively. There is the Global Action Plan on Prevention and Control of Non-Communicable Diseases, the Comprehensive Mental Health Action Plan, which covers dementia, WHO Global Disability Action Plan, and also Global Strategy and Action Plan on Aging and Health. But the next year, WHO is going to come out with, hopefully, if the member states agree, with a Global Action Plan on Public Health Response to Dementia. I'll just come back to it. This has 8 years of time frame. This is very deliberately titled as the health response to dementia rather than just the burden of dementia, because we need to focus attention on that. There is the introduction, the overview of the global situation, a vision, a goal, cross-cutting principles, strategic action areas, and proposed actions and targets. The vision goes like this: a world in which dementia can be prevented and people with dementia and their carers can live well and receive the care and support they need to fulfill their potential with dignity, respect, autonomy, and equality. It has three main components: the human rights aspects, the prevention aspects, and also the care aspect, especially the care by formal as well as informal carers. The goal is more modest. The goal of the action plan on the public health response to dementia is to improve the lives of people with dementia to whatever extent we can, but also of their carers and families, while decreasing the negative impact of dementia on them as well as on communities and countries. It has 7 cross-cutting principles, and note here that the human rights come right at the top, but also empowerment and engagement of people with dementia and their carers, evidence-based practice, multi-sectoral collaboration, because it's not only a problem of health, it involves all other sectors, universal health and social coverage, equity and appropriate attention to dementia prevention, cure and care. We do believe that we need to know much more for finding the cure for dementia, but people cannot wait. Care has to start today. The strategic action areas are dementia as a public health priority, high up in the governance, dementia awareness and friendliness. Many countries have dementia-friendly communities programs, dementia risk reduction and prevention, dementia diagnosis, treatment, and care. Let's remember that more than 50% of people with dementia are not diagnosed in the so-called developed countries. The state in low and middle income countries, it's much, much worse, and we need to increase that. Support for dementia carers, information systems for dementia, and finally, dementia research and innovation, which of course are very important. The action plan is going to be considered by the WHO's Executive Board in January next year and by the World Health Assembly in May next year, and hopefully there will be enough indicators and targets for us to go forward. However, do we need to wait for the action plan? There are things that we can do now. This includes scaling up programs for prevention, also scaling up implementation of the care. We have the MHCAP program, which includes dementia, training of care providers, especially general doctors and nurses, investing in systems for coordinated care across health and social care, which is extremely important, involving and empowering dementia carers to improve outcomes, and investing in research and innovations by dementia care. The panel has a lot of experience. We are happy to have answers to many questions you might have. With that, I hand it over back to Dr. Khalid.
Thank you very much, Dr. Saxena, for taking us through this very rich presentation, and at the same time highlighting for us that why dementia is a public health issue. And it's, I think, goes beyond public health. It also concerns the safety and security of the countries and the nations. So I'll request my fellow panel members, starting from Mark Wortman, to share their perspectives before we go to the audience. Yeah, the mic is there.
Good morning, everybody. My name is Mark Wortman, and I'm Executive Director of Alzheimer's Disease International. We are the global federation of all the patient and family organizations of people with dementia. And we're at the moment in 85 countries. We're very happy with the steps that the World Health Organization has taken, and I think there's no time to lose. The world population is aging. There's a number of countries where dementia is already the leading cause of death, like the UK and the Netherlands and Japan. This is not happening yet here in Qatar or in the Middle East, but you can see from the statistics that it will happen over the next decades, and you can prepare for that, which we didn't do so well in the European countries. So I think this program of action is very comprehensive. It touches on all the important issues. What we feel is very important as a first step is to raise awareness about the disease, make clear that it's a disease, that it's not something that's your fault, and that people with dementia need support, not only from the health system, but also in the day-to-day activities. And Shaka mentioned dementia-friendly communities. I think that's a very important program, easy to start, not very costly, as a way to be inclusive as a society and to support people in their own environment. For ADI, it's also the long-term goal that we find a cure, that we get rid of this disease, because it's very difficult to live with. But for the time being, we support people living with dementia the best we can. And I hope the plan comes through the World Health Assembly. And we're also an organization that can give support in your countries if you want to develop your own plans. We have a lot of expertise. We have energy. We have people who have the experience of living with dementia, and they're very good advocates to help you. Thanks.
Thank you. Thanks, Mark. I think we move to Mike for his perspective.
Thank you very much. My name's Mike Hobday. I'm the director of the World Dementia Council. We are the legacy body from when David Cameron raised dementia through the G8 and G7 process. 24 senior leaders from academia, from across industry, from the NGO community, and including people living with and affected by dementia, all working together to make sure there's a truly global approach to the action against dementia. Dr. Saxena's slides show very clearly the challenge we face, the expectation that 135 million people across the world will be living with dementia by 2050. A burden that in terms of demographics will increasingly fall on low and middle income countries, with a burden of care particularly falling on women in these countries. The challenge exists and is so great, in part because of the success of research into heart disease and cancer, which have transformed prognosis for those conditions, simply enabling us to live long enough for us to get the disease of dementia. And with research into dementia in recent years having a 99.6% failure rate, this is truly one of the challenges of our age, and a challenge to governments, to the World Health Organization, to all of us in this room to pick up and take on that challenge. So the World Dementia Council, in wanting a truly global approach, is focusing on 5 areas. Firstly, funding for research. We're working at the moment to identify the particular gaps in dementia research funding, which still falls way below cancer research funding, in order to have conversations about increasing appropriately dementia research spend. Secondly, working to make sure that there's a truly global approach to research collaboration, and in particular, working with countries around the world to help them to work together with the EU program, the Joint Program for Neurodegenerative Disease, to make that a global research collaboration. Thirdly, working with health service and health system payers. One of these days, the pharmaceutical industry will develop a drug that works for dementia, and demand will skyrocket around the world. We need to work now to make sure that health systems are prepared for that moment, so that effective treatments are available right across the world. Fourthly, on care, the World Dementia Council is working to create a really strong statement on the need for and the principles of good dementia care in order to support strategies and plans around the world, and will then be identifying the research needs arising from that. And then finally, on prevention, we're working across high-income and low- and middle-income countries to make sure that the prevention research, perspective of low and middle income countries is fundamentally built in to academic research on dementia prevention. So it's a privilege to be here and to follow up what I hope people have picked up outside, the excellent WISH report from 18 months ago, summarising the need for action. The time for action is now, and the World Dementia Council is keen to work with everybody in this room to make that action happen. And we look, of course, to all of you to play your part in that process. Thank you.
Thank you, Mike Hobday. I think we have heard from the global perspective. Now we would like to have the perspective from the country, that how do you see things happening and where do you think the challenges are and where do you think the opportunities are? So Dr. Hanadi, please.
Good morning, everybody. My name is Dr. Hanadi Al-Hamed. I'm internist background and I train geriatrics, and I'm an additional assistant professor in Weill Cornell University. Geriatric department, just I will give you a brief geriatric department and long term. The health system in Qatar oversees by Ministry of Public Health. And under Ministry of Public Health, it came Hamad Medical Corporation, which compose a lot of specialty. One part of them is geriatric and long-term department. Under Ministry of Public Health, there is a primary health center, BHCC, which we have around 25 oversight all Qatar. In addition, we have a private sector, Sidra and Isbitar. This in general about health system in Qatar. So from here, geriatric department, 2013, we tried to look really regarding the dementia burden and increase the awareness of community. We as isolated department, you know, in the state of Qatar, we cannot manage much unless we start memory clinic, and that I think it's unique in the Gulf and with multidisciplinary approach. We continue to follow update and international guidance till January this year, when State of Qatar invited by WHO to participate in Global Dementia Observatory, which was really challenges, and at the same time is, I think, the best way for any country to start, because WHO, they have excellent landscaping as in the presentation. The observatory start by sending for us KPI, what we have in state of Qatar, and from there we can start. The 4 themes presented in the presentation earlier about the policy, burden, capacity, research. I will tell you the truth, we start from scratch. At that time, we don't have much unless our memory clinic and trained geriatrician. From there, I sit and I decide what the next step, what we can do. I got support from my leader in the level of my hospital and the corporate. And from there, we start to have themes and a workforce grow for each theme. Challenges I face is the first one, quantification, the prevalence. As I mentioned, the state of Qatar, we are multiple, you know. So to get the prevalence with the dementia cases seen by neurologist, geriatrician, psychogeriatric, primary health center, how to get all this prevalence. So from there, we start the first challenge, quantification. The incident, mortality and morbidity related to dementia. The other challenge was how to reduce the stigma and to increase the awareness regarding early diagnosis of dementia. We handle a lot of campaign this year, but still, you know, we are looking for more. The other challenges, I think, for any program to succeed, it must be on the national agenda. And thank God this is the one I achieved this year. So dementia now a national agenda, and we formulate a national stakeholder working group for dementia. Of course, everybody knows that dementia cure is, you know, it's one of the big burden, but most important, any health system to concentrate on cost of care. So cost of care, you need infrastructure, capacity, and the space, and this is part of the agenda we are working. Thank you.
Thank you very much, Dr. Hanadi, for giving us this brief presentation about what's happening in the state of Qatar. Just to remind you that tomorrow we are also going to have a side meeting on dementia, which is going to take place at Hamad Medical Corporation. And we'll have a number of countries from the region presenting on what's happening. So that would be an opportunity which I think should not be missed. And it would provide us more sort of broad idea about where we are going in this region and globally in general. So given that I'm also conscious of the fact that we are also running a bit short of time, so I'll request if there are any comments, any observations, any questions from the audience. We have one up there, 2, 3. So can we start with the gentleman up there? Up there, up. All right. Dr. Jawad.
Thank you very much, Dr. Khalid and the panel for this nice presentations. I just want to ask, in the action plan of the headquarters, which just was projected on the board, I didn't see anything about the surveillance and how do we integrate that into the current NCD surveillance, or even the standalone surveillance for dementia. This is my first question, so maybe I missed it, but if it's there, could you please highlight it for us? The second thing is that I just want to ask why there are so many resolutions and action plans and other things which you have shown on the board from the World Health Assembly that did not resonate within the countries. If all 5 or 6 you have shown did not make any difference, why you think the next one, which will be the action plan 2017-25, would make a difference? Thank you.
All right. Thank you. Maybe we can take the 2. Yeah, please.
Yes, good morning. Tom Wright, I'm the Chief Executive of Age UK and Age International. Dementia, as we know, is often a comorbidity, i.e. 90% of people with dementia have other long-term conditions. And we know for dementia that the risk factors are partly modifiable, 30 to 50% modifiable, as for many of the other same long-term conditions that people with dementia may have, like diabetes or hypertension. So what we're seeing is that the numbers of people with dementia are increasing around the world because we're living longer, but there's some evidence that the prevalence is slightly declining in Western Europe due to better lifestyles, etc. So my question is, what one thing could health economies in low to middle income countries do to improve outcomes? For example, testing and reducing hypertension, improving diet, ceasing smoking. What was the one single thing that could transform the prospects to reduce the prevalence of dementia in low to middle income countries?
All right. And maybe we can have gentleman up there.
Thank you. Henry Brodati from Australia. Previously a chairman of Alzheimer's Disease International and a clinician and researcher in the field. A number of points. One is the change needs to come from the bottom up and the top down. So consumer groups are really important to involve in every country, and it's very heartening to hear what's happening in Qatar about that, but also top down having plans and plans that work. Secondly, Alzheimer's is only one of the dementias. It's about half of the dementias. And as you pointed out, 99.4% of all trials have failed in the last 15 years. But even if one succeeds, we'll still have a lot of dementias without any drug treatments. I think dementia is here to stay, no matter how much we hope for a cure, and I'm certainly hoping very hard for that. Thirdly, in answer to what we can do in lower middle income countries, I think the answer is even earlier than what has been suggested. It's right in early childhood. It's in education. And we know we look at those risk factors for dementia in the lower middle income countries. Low education is the major risk factor. In countries in Western Europe and the United States, it's obesity, it's physical inactivity, and they're much so modifiable by a personal level, whereas education really involves a whole of government approach, and it's looking at the early childhood. And just one practical suggestion, I have an interest lately in developing a registry for dementia in my country, and we've done a review of registries around the world. And here is an opportunity to work with the Global Dementia Observatory to have some harmonization of registries, to have a minimum data set, to have the same language, the same ethical procedures, the same opt-in versus opt-out, et cetera, so we can start looking at a global level about the numbers of people with dementia, the trajectory they go through, and how we can work with treatments for them. Thank you.
All right, thank you. Shekhar, I think quite a number of questions actually seem to be directed directly at you. I think about surveillance and the last point about harmonization of the different efforts which are ongoing, and why this particular resolution would find more resonance with the countries, before we have other panelists coming out about outcomes and so on.
Thank you, Khalid. Let me respond briefly, although I'm very happy to have much more explanation later on. Surveillance is very much there as a part of the Global Dementia Observatory plans. There is the domain of the prevalence and the burden, and that will certainly be a process by which we will cover the national, the regional, and the global figures on the prevalence and incidence, and surveillance also for the response, not only of the burden, but what is happening. So on both sides, surveillance will certainly be there. WHO's action plans very frequently have a major impact on the way things go in the world. Remember that smallpox was erased from the surface of this earth. Remember that malaria and tuberculosis and HIV have made a tremendous progress in the past because of the WHO's efforts and action plans. It doesn't mean that every action plan will have a process, but remember also that NCD action plan does not specifically include dementia. That's why some countries, including Switzerland, and I see a representative of Switzerland here, thought that a specific action plan on dementia will be necessary. WHO Secretariat responds to the member state requests, and in this case, we are very happy that they are putting this higher on the agenda for WHO, but also for the countries. So we do hope that this action plan will have serious increase in the investments and in the public health priority given to dementia. Risk factors certainly play a very major role in decreasing the burden because of dementia. In fact, as was pointed out, in some of the countries, the age-specific incidence rates have been coming down because of the careful increase in attention to the risk factors. But the same is not happening in low and middle income countries. The risk factors are increasing, the age-specific incidence and prevalence both will increase, and that's what we are worried about, because majority of the world lives in low and middle income countries. That's where the message needs to go out, and hopefully the action plan will make good progress on that. Education, one of the major factors, as was pointed out, which can be a protective factor for dementia. And certainly, it is part of the Sustainable Development Goals, education for all, and this is another argument as to why people need education. Not only initial education, but a continued education over the life course to decrease the possibility for dementia. Very important, we are highlighting that. Registry, not sure about every country, some countries will have, but harmonization between what the countries are already collecting in terms of data and what the Global Dementia Observatory will do is certainly on our agenda, and we are reviewing the data collection processes in many countries to see that we don't put unnecessarily burden to collect additional information. We do with what countries are collecting. Back to Khalid.
Yeah, Mark, maybe.
Yeah, I think most issues are answered. Just want to touch on the declining prevalence in some countries. In our latest World Alzheimer report, we showed that the prevalence in Europe was down from 7.3 to 6.9% of those over 60. However, because there are many more people over 60, the total number is still going up. So it's extremely important to promote a better lifestyle, which is good for your heart as well. What is good for the heart is good for the brain. But it will not help enough, and all the other measures are necessary. I think the point of the registries is a good point, and ADI is looking into that as well. And we can work together on finding out the best practices so that the things are comparable. And the other point that was made by Henry Brodati, the involvement of people with dementia and their families is crucial to get a good understanding what their needs are and how they can be helped in their own situation. And of course, we shouldn't forget that. So it's good you brought that up.
Thank you. I'd like to respond in particular to the gentleman towards the back of the room who said, why are things going to change now when there's been so many strategies and plans before? And it really feels to me that there is now, right now, there is a momentum around dementia. You see the interest and the enthusiasm of everybody in this room. You see increasingly governments around the world developing their own dementia strategies and plans. We see the World Health Organization looking actively at providing support and guidance and oversight to what member states are doing. And you see the establishment of mature global networks like the World Dementia Council, like other bodies, working to share the priority for dementia and the availability of expertise and best practice. These are all things that really weren't in place even 3 or 4 years ago, and there is a wave of progress that I think everybody in this room has the opportunity to ride.
I want to emphasize that prevention and risk reduction of dementia is evidence-based, and reducing, risk of diabetes and hypertension, control them, really it will help delay the onset of dementia or as a preventive. Regarding the registry point, when we start our observatory, this is the point we are facing on database collection or registry, because there is no standardization international. So we seek WHO to send us other experience, and the things we are facing that, for example, cognitive assessment. Shall we use a mini mental MOCA or to be, to compare ourselves with the other? What the scoring for disability we can use? What other element will be in registry? So really, I think to standardize the registry for dementia, the element of registry, I recommend it.
Fine. I think we are coming down to the last minute of our allocated time. So what we are seeing here is that, particularly as regional advisor for this particular region, let me highlight the fact that in terms of both behavioral and metabolic risk factors, countries in this region have the highest rates in the world, some of the countries in this region. So it's not a problem which is going to elude us, or we will escape unscathed. We will have this problem. So the message here is, and which has been resonating throughout, that there is a need to focus on the whole spectrum, starting from prevention to care, with involvement of the whole of government. I think the colleague here mentioned that, for education, but it's also important when it comes to care of dementia, that it's not just health sector, it goes beyond the health sector, and we need to involve the whole of government approach needs to be there, which is also underpinning the NCD action plan, the whole of government approach. So I think there is a lot of convergence with the number of plans which Jawad was mentioning, that all of these actually have a point of convergence, and we need to find that and synergize the actions which are there in each of those plans. And this is particularly important for this region, where we still have the opportunity to learn from what has not been done or what has been done imperfectly in other parts of the world. So the important thing is that all of us need to be in on this particular effort, rather than relying on one health system to deliver everything. So with that, I think I'll hand it back over to Shekhar for some final words of wisdom.
I
We are
think we
running.
have had good discussion, but the discussion continues. So we are here for any further discussion during coffee time and otherwise, and look out for the action plan from WHO coming May. And WHO's technical support is available now and later on. So if you have any questions, come back to us and we'll try to help you. Thank you again very much for coming here. It has been a wonderful morning, hopefully a good start for the rest of the day. Thank you very much.
Thank you very much.